I personally am now considered a major influence on my patients' care in the eyes of the physicians that I refer with. I go back to, there was one buddy I used to have, my dental school and med school right next to each other. We'd go to the cafeteria for coffee. I love coffee. And we'd get there and we'd have our coffee, and boy, they were just considered doctors the moment they entered school. We were rarely considered doctors even after we graduated. And now, this particular physician's in my area, and he is close to my practice, and we have mutual patients and we have mutual referrals going back and forth. And lo and behold, some 30 years later, he and I have a great relationship, and he actually considers what I do with my dental practice every bit as important as what he does in his medical practice. So this is not just about me feeling good about myself, but understanding that we as dentists are an important part of the healthcare in our community and for our patients. I'm sure you've seen the movie Little Shop of Horrors, and that was the perception that us dentists had. We were that joke, that person that was inflicting pain and causing trouble for people. That was the perception that people had coming to our offices. We've had to deal with this our whole career. We are not the ones that are helping people in their minds. We're the ones that are inflicting pain. I mean, how many times in a chair does a patient say, oh, there's someplace I'd rather be than here? We're not that anymore, and we haven't been that for a long time. We are now an important part of preventing disease for our patients, and that elevates us to a much higher level, and it really brings us into an important point in patients' lives. What more can you do for somebody than to help them live a healthier life and to reduce their risk for disease? And when patients see you as that person, you completely change the way you practice. So dentistry is changing whether you like it or not. And I want you to do this. Go out a few years to when you're older and you're just sitting in that rocking chair. Look back at what you've done. Do you want to be the one that just did what was comfortable 30 years prior? Most of the time we do what's comfortable a long time ago. We're not even doing what's current. We're definitely not doing what's going to happen in the future. Think about yourself. Do you want to just be that dentist that did the simple things that really were so old and outdated? If everybody lived that way, we'd still be doing nothing but extractions and doing amalgam fillings. Now is the time to transition into the new era of health and wellness and look back and see just how you would feel about yourself, how much fun you would have had by embracing that. It's simple, it's not hard to do, and really become that part of healthcare. Step into that, greet it, meet it, don't miss it. This is an important part, and you'll love it. So what excites you about this opportunity? Let me know, comment below.